I'm Stephanie Sarantopoulos, and I'm a bone marrow transplant physician. Patients come to me after they've received treatment for lymphoma or leukemia or multiple myeloma, and the treatment unfortunately hasn't been successful, or they know already up front that their disease is high risk and requires further therapy. So I have the data and the information from the physician, but when the patient comes, it's really important for me to hear from the beginning to the end what's happened to them up to the time point when they come in the door. So we understand the disease status and get to know them a little as a person so we can make a treatment plan together. I'd like to get to know the person a little bit in terms of their background and their sort of wishes and desires in a very short order, and so that sort of entails literally getting to know their story in a short period of time. The first questions I usually ask are, what do you do for work, where are you from? And that kind of a conversation starts initially, and it helps tremendously in terms of leading into my telling them some frank realities about what bone marrow transplant is, and sort of then helping me guide them in terms of what they think they're willing to take on in terms of risk and benefit of the treatment. What really inspired me was globally trying to help people. I grew up in a restaurant, the Olympic Pizzarama, in a tiny town in Arizona, a kid of immigrants. At least my mother's a direct immigrant, my father's a kid of immigrants, and just really serving the public was part of our mission. You know, we made good food, but then I had the opportunity to get educated. So when I went to college, I took some science courses and was also helping handicapped children, and at the same time really realizing that I could do more.